So I'm here today with Tony Germain, who is on the governance board committee for Plan, Design and Expenditures. And I'm really excited to be interviewing you today so that people can be familiar with the good work that you guys are doing over there.
Well, thanks for the opportunity. I'm excited to share the body of work and some of the content we've been moving forward with.
Can you tell me a little bit about your background and how it drew you to the committee?
Yeah, so by training, I'm in the healthcare field. I'm a family medicine doctor, and I practice for a federally qualified health center in the Woodburn area, and also serve in the capacity of an educator where I teach a fellowship training program to help family medicine doctors expand the scope of their care for obstetrics care and deliver babies and deliver via C-section and some other procedures. I also have an interest in this area in general because some of my past work and study is in public health. And just really interested in improving our healthcare system as a whole, and have been involved in advocacy for universal healthcare and single payer policy for about 20 years now. And so the committee's work was an opportunity to join in and look at potential policy decisions where we could continue to support the work of the governance board.
Awesome. And then I'm curious, can you tell me a little bit about what the objective of your committee is?
Yeah, our committee is charged with looking at some of the elements of the universal healthcare plan, and that is inclusion of eligibility, the benefits design, looking at things like cost containment strategies, and looking at certain elements like how you allocate budgeting in the plan, and utilization management.
Really exciting. I know a lot of those topics that you listed off are things that people are very excited to know about what's going to be included in the plan. So that's great. This kind of goes along with the last question, but what are some of the big tasks that you're working on in your committee in the next couple of months here?
Yeah, we've really kicked into gear, and we started out with looking at what should be the benefits package of a universal healthcare plan. And we looked and did some study and research the current plans, looking across the country, looking in different sectors. So that being in the commercial sector, but also looking at different populations that require expanded benefits and what we call enhanced benefits. And that's in the sector where you might find individuals that are lower income, that might need more support like transportation to get to their appointments. So we looked at Oregon Health Plan, looked at a number of the CCOs, and also looked at the Public Employees Benefits Board, the Oregon Educators Benefits Board, the eligibility, the benefits package for those. As mentioned, we also have been looking at how you determine eligibility in the state. And in a single payer system in a state, really, that's pretty straightforward. It's everybody that lives in Oregon. But there are some nuances that go with that. Let's say somebody lives across state lines, maybe works in Oregon, but lives outside the state. Maybe somebody does vice versa. Maybe you have somebody that is a retiree and had worked the body of their career in the state of Oregon, but now spends a lot of time in like Arizona during their retirement. We've also we're looking at provider payments and looking at how we support and promote primary care, as well as behavioral health in our system.
Great, because we definitely need to see more behavioral health for sure. And then we know primary care prevents problems from getting worse with patients. So that's wonderful to see. I guess that leads me to the next question, which is what do we know for sure is going to be in the plan? Or do we know?
Yeah, and those are all good questions. And I think our committee is an advisory committee. We don't make any formal decisions. So nothing at this point has been clearly defined. We are presenting straw proposals and an investigative look at some of these questions, but ultimately that will be determined by the governance board themselves that will make the recommendation to the legislature when they give their report.
Okay, I didn't realize that. Okay, that's good to know. Do we know for sure what will go in the straw proposal to the governance board?
Yeah, no, I think one thing that we're really leading into is the review of the benefits package and what we'd ideally like to promote. And this mirrors some of the work that was done in Senate Bill 770 and the original Universal Healthcare Task Force, models off of that. But we are promoting the Public Employees Benefits Board's benefits package, but then maintaining the integrity of some of those other features, enhanced benefits that OHP has for those that would qualify under Medicaid, under that state program for that income eligibility. And again, just a call out for some of those would be something on the order where transportation to and from visits, to clinic visits or specialty care would be covered under OHP, but that wouldn't be a traditional covered benefit under PEB. So that would be a recommendation so that we can keep people getting to and from their visits would just be an example.
This is something that I've been wondering about for a while. And it's if you're modeling it off of OHP and the public employees benefits, don't they each have their own like commercial health plan that they work with inside of like OHP or for the public employees?
So the public employees is a commercial plan essentially, and so there is a board that looks at review of options for individuals that are on those plans, and they're pretty robust. It's a pretty robust benefits package that is goes beyond probably some of the coverage that you would see on OHP. But again, there's some nuances in that OHP does cover some things here and PEP covers more broadly, more coverage.
So if you're on OHP,
Mhm.
then don't they put you on like Providence or Kaiser or something else like that?
So what you're referring to is the community care organizations, the CCOs. So if you're on the Oregon Health Plan, which is a Medicaid plan, you are delegated usually regionally or geographically to a CCO. And that CCO is a managed service organization. It helps to facilitate the delivery of care and make sure that payment takes place in that geographic area. So you are correct in that way.
So how do you model it off of that?
Well, I think that this is also some of the work that we're currently in presently. We're looking to see how best to allocate regional control versus state control. One of the issues that is coming up is in a single payer system, risk is maintained by the state. It's no longer maintained by an individual CCO or commercial provider or like PEB. That is consolidated in just to one single entity, and that would be state. But we're looking at different models of how to do that, and also looking at potentially something that would model that the state of Connecticut is doing, which is an administrative service organization, ASO. And I know there's a lot of alphabet soup here, uh,
Mhm.
but really what an ASO and what a CCO is like who bears the risk, who has, at the end of the day, who has to pay. And so in a single payer system, you would simplify that and you would remove the redundancies and the administrative burdens that take place, just having under one. But you still want care to be local. You want it to be influenced by the community that is around there. And so regionally, it would be a benefit to potentially have a model that might mirror some of the aspects of a CCOs, because CCOs do a really good job in helping coordinating care. They help facilitate communications between providers and health systems, and making sure network advocacy is appropriate. So we're looking at some of those questions and offering a further investigation on that to the governance board. That will probably be over the next couple months, looking at that question.
Wonderful. That's great to hear. Can you tell me a little bit about the contractors that you guys are working with?
Yeah, we are supported. The governance board has a number of different contracting work. Presently, we have a group called HMA that helps us do some investigation and research and provide a little bit further analysis. When we're looking at some of these questions, we can offer as a subcommittee to look at a look at total spending in the state for primary care, for mental health services, for behavioral health, specialty care, and get feedback. So they help facilitate the work and bringing information that the committee might need to help make decisions.
And then last question here, what are you most excited for to see in the plan?
I am very interested in this endeavor to make sure that patients are getting the care they need when they need it, getting the medications when it is appropriate for them to get that, and when it's indicated by a provider to recommend that people get the surgeries and procedures that they need, that they're not hindered or burdened by barriers such as the copays and deductibles. And I think that the way that we're collaborating on these subcommittees and with the governance board is that it is a public meetings law, is that we're doing out in front of the state of Oregon. Anybody can listen into these. So I'm really excited about us moving as a state forward and having these open discussions about these tough policy considerations. But it's, again, out in front. It's not behind closed doors where a lot of commercial insurance, a lot of my patients, and the decision making whether somebody gets a prior authorization approved or not. And fundamentally, what it comes down to is that we can achieve a plan that has a robust benefits package for everybody in Oregon and deliver good clinical outcomes and good outcomes for us as all Oregonians.
So many people are excited for the work that you guys are doing and just to see the outcome of the plan. So, anyways, thanks so much for meeting with me. I really appreciate it.
Thanks for the conversation.
Yeah, absolutely.